When was the last time you turned on the news and ever got a window to the outside world? When did you ever get an update about how the rest of the world is handling COVID? Never. What's happened in this pandemic is the world is closed in on us. There's only one doctor whose face is on TV now. One. Not a panel. Doctors, we always work in groups. We always have different opinions. There's not a single media doctor on TV who's ever treated a COVID patient. Not a single one. There's not a single person in the White House task force has ever treated a patient. Why don't we do something bold? Why don't we put together a panel of doctors that have actually treated outpatients with COVID-19 and get them together for a meeting? And why don't we exchange ideas? And why don't we say how we can finish the pandemic strongly? Isn't it amazing? Think about this. Think about the complete and total blind spot. So what happened? I can tell you what happened. What happened in around May, it became known that the virus was going to be amenable to a vaccine. All efforts on treatment were dropped. The National Institutes of Health actually had a multi-drug program. They dropped it after 20 patients, said we can't find the patients. The most disingenuous announcement of all time. And then Warp Speed went full tilt for vaccine development. And there was a silencing of any information on treatment. Any. Silencing. Scrubbed from Twitter, YouTube. Can't get papers published on this. We can't even get information out in our own medical literature on this. There's been a complete scrubbing. So this program has been one of try to reduce the spread of the virus and wait for a vaccine. And when we vaccinate, all efforts have to be on vaccination. And probably if I had 4 hours of vaccination on here. Think about it as we sit here today, the calculations in Texas on herd immunity. The calculations are we're at 80% herd immunity right now with no vaccine effect. 80%. And more people are developing COVID today. They're going to become immune. People who develop COVID have complete and durable immunity. And a very important principle, complete and durable. You can't beat natural immunity. You can't vaccinate on top of it and make it better. There's no scientific, clinical, or safety rationale for ever vaccinating a COVID recovered patient. There's no rationale for ever testing a COVID recovered patient. My wife and I are COVID recovered. Why do we go through the testing outside? There's absolutely no rationale. I'd encourage this committee to actually look at what's being done and ask, is there any rationale? Is there any rationale for anything? Listen, there's plenty of COVID recovered patients. Let them forego the vaccine and let people who are clamoring for it get it. But at 80% herd immunity, in the vaccine trials, fewer than 1% in the vaccine and the placebo actually get COVID, fewer than 1%. The vaccine's going to have a 1% public health impact. That's what the data says. It's not going to save us. We're already 80% herd immune. If we're strategically targeted, we can actually close out the pandemic very well with the vaccine, but strategically targeted. People under 50 who fundamentally have no health risks, there's no scientific rationale for them to ever become vaccinated. There's no scientific rationale. One of the mistakes I heard today as a rationale for vaccination is asymptomatic spread, and I want you to be very clear about this. My opinion is there is a low degree, if any, of asymptomatic spread. Sick person gives it to sick person. The Chinese have published a study, British Medical Journal, 11 million people. They're trying to find asymptomatic spread. You can't find it. And that's been, one of important pieces of misinformation. When Senator Hall called a conference call of what should we do in the Capitol when we reopened, I said, you know what? You know what we do at Baylor? You walk in and they zap your temperature. You got a temperature check and go in. Do we test everybody who walks in the Baylor Hospital? No. Are they a lot sicker than everybody in this room? You better believe it. So why would we do something here at the Capitol that has absolutely positively no scientific rationale and then do it in this context? So my testimony as I sit here today is COVID-19 has always been a treatable illness. A very large study from McKinney, Texas, another one from New York City, show that when doctors treat patients early who are over age 50 with medical problems with a sequenced multi-drug approach with the available drugs, 4 to 6 drugs that are available to them, now the monoclonal antibodies are better, there's an 85% reduction in hospitalizations and death. 85%. 85%. I want you to remember that number, 85%. We have over 500,000 deaths in the United States. The preventable fraction could have been as high as 85% if our pandemic response would have been laser focused on the problem, the sick patient right in front of us. We were focused over here and focused over there and focused on masks and what have you. Laser focused, sick patient, treat them. We lost focus on the most fundamental thing.
Dr.
That's my testimony.
Yeah, thank you.